Mississippi, often celebrated for its rich cultural heritage and historical significance, faces numerous challenges that hinder its socioeconomic progress. These challenges are deeply rooted in its history, economic structure, social fabric, and political landscape. Addressing these issues is crucial for improving the quality of life for its residents and fostering long-term development. Here are the top 14 challenges facing Mississippi today. Number 1. Poverty. Mississippi has one of the highest poverty rates in the United States, with nearly 1 in 5 residents living below the poverty line. This pervasive poverty severely limits access to essential services such as healthcare, education, and housing. It also restricts opportunities for economic advancement, perpetuating a cycle of hardship for many families. High poverty levels contribute to poor health outcomes, lower educational attainment, and higher crime rates, creating significant barriers to overall economic development and social mobility within the state. Addressing this issue is crucial for improving the quality of life for Mississippi's residents. Number 2. Mississippi has a high teen pregnancy and birth rate, among the highest in the United States. Contributing factors include limited access to comprehensive sex education, socioeconomic challenges, and inadequate access to reproductive health services. Addressing these issues requires enhanced education, resources, and support for young people. Number 3. Mississippi has a high suicide rate, particularly among young people. In 2022, the state reported a rate of 20.4 per 100,000 individuals, significantly higher than the national average. This highlights urgent mental health support needs. Number 4. Mississippi has a high rate of child abuse and neglect, significantly impacting the well-being and development of its children. Contributing factors include socioeconomic challenges, limited access to support services, and systemic issues within child protection systems. Addressing these concerns is critical for improving child welfare in the state. Number 5. Mississippi's long history of racism and discrimination continues to impact communities, perpetuating socioeconomic disparities and systemic inequality. This legacy affects access to education, employment, and healthcare, significantly hindering progress toward equality and social justice. Addressing these deep-seated issues requires comprehensive efforts to combat racial inequities and promote inclusive opportunities for all residents. Number 6. Mississippi's political polarization and resistance to change hinder progress on various fronts. Lawmakers' opposition to expanding Medicaid leaves many uninsured, while underinvestment in education perpetuates achievement gaps. This partisan gridlock stalls efforts to address poverty, healthcare, and economic development, leaving the state mired in stagnation and hindering opportunities for growth and improvement. Number 7. Mississippi has one of the highest infant mortality rates in the nation. Contributing factors include inadequate prenatal care, high rates of preterm births, and significant socioeconomic disparities. These issues are exacerbated by limited access to quality healthcare, particularly in rural areas, and pervasive poverty, which affects overall health and nutrition. Addressing these factors is essential to improving infant health outcomes and reducing the state's infant mortality rate. Number 8. Mississippi suffers from a brain drain, with educated young people leaving the state for better opportunities elsewhere. This exodus of talent impedes economic development and innovation as the state loses skilled workers who could contribute to growth and advancement. Addressing this issue requires creating more attractive opportunities and investing in industries that retain and attract young professionals. Number 9. Mississippi has one of the highest obesity rates in the country, resulting in increased incidences of related health problems such as heart disease, diabetes, and stroke. This epidemic places a significant burden on the state's healthcare system, driving up costs and straining resources. Contributing factors include limited access to healthy food options, lack of physical activity, and socioeconomic challenges. Addressing obesity through education, improved healthcare access, and community initiatives is crucial for enhancing overall public health in Mississippi. Mississippi has high rates of AIDS and sexually transmitted diseases, with prevalence rates exceeding national averages. Contributing factors include limited access to healthcare, lack of education about prevention, and socioeconomic challenges. Addressing these health issues requires improved healthcare access and comprehensive sexual health education. Number 10. Mississippi is highly vulnerable to natural disasters, including hurricanes, floods, and tornadoes. These frequent and severe events cause substantial economic damage and displace communities, complicating recovery efforts. The state's geographic location and environmental conditions contribute to this vulnerability, making it challenging to rebuild and support affected populations. Effective disaster preparedness and response strategies, along with robust infrastructure investments, are crucial to mitigate the impact of these natural disasters and aid in faster recovery. Number 11. Mississippi has faced numerous high-profile political scandals and corruption cases, which have severely undermined public trust in government. These incidents reveal persistent issues of governance and accountability, creating significant obstacles to effective leadership and state progress. Such corruption undermines confidence in public institutions, hampers efficient administration, and exacerbates existing socioeconomic challenges, making it difficult to implement effective policies and achieve sustainable development. Addressing these issues requires systemic reforms and increased transparency in government operations. Number 12. Unemployment rates in Mississippi are higher than the national average, exacerbating economic challenges and poverty. The scarcity of job opportunities, especially in rural areas, limits residents' ability to find stable employment and achieve financial security. This lack of employment options perpetuates a cycle of poverty as individuals struggle to support their families and access essential services. Addressing this issue requires targeted economic development initiatives to create more jobs and improve workforce skills. Number 13. Mississippi faces a severe affordable housing crisis, with many residents living in substandard conditions. Homelessness is a growing concern, disproportionately affecting veterans and low-income families. The state's limited affordable housing options, combined with poverty and lack of resources, exacerbate the issue. Addressing this crisis requires increased funding for affordable housing initiatives, supportive services for vulnerable populations, and collaborative efforts between government agencies, nonprofits, and community organizations to provide safe and decent housing for all Mississippians. Number 14. Mississippi's education system grapples with inadequate funding, low teacher salaries, and poor student outcomes. These issues contribute to consistently low rankings in national education assessments, restricting future opportunities for students. The lack of resources affects classroom quality, student engagement, and overall educational achievement. To improve outcomes, significant investment in education is necessary, including increased funding, better teacher support, and comprehensive reforms aimed at enhancing the quality of education and student performance across the state.